This is a coronal section of lung from a patient with cystic fibrosis and a section of normal lung for comparison. Cystic fibrosis is an autosomal recessive disease in which there is a mutation in the CFTR gene, resulting in a dysfunctional epithelial chloride channel protein and impaired chloride transport. The fluid from exocrine glands becomes thick and viscous, as does the mucosal fluid of the respiratory, GI, and reproductive tracts. Mucus plugs block glands, causing pancreatic insufficiency, malnutrition, focal biliary cirrhosis, GI obstruction, and male infertility. Infection is also common. The lungs are the site of the most serious adverse complications. Bronchioles are distended with thick mucus, and there is superimposed bronchitis and bronchiectasis. On gross examination, there is extensive mucus plugging and dilation of the airways. Although the mucus has been washed away during fixation, you can appreciate the dilation of the airways, as well as the bronchiectasis. The parenchyma becomes consolidated from infection, which you can see here. Microscopically, mucus plugging and inflammatory cells can be seen, as well as hyperplasia of the submucosal glands.